Dr. Ankit Thakkar, Executive Director and CEO of Jupiter Lifeline Hospitals, is joining us now. Dr. Thakkar, afternoon. Thank you so much for your time. We understand that you are making inroads and firming up your grip in the western side, especially in Dombivli. You're coming up with a new hospital. I want to understand. We speak to a lot of hospital chains here on the channel. We are seeing aggressive expansion by many chains, and now you too, in western market, including Mumbai. What is the big? Is it medical tourism, or is it big demand? What is the driver of the big demand here?
So thank you for having me. I think the answer is quite simple. It is not complicated. If you just do a simple demand supply analysis, you will see that the supply of quality healthcare beds in western region, including Mumbai city, is completely skewed, and the demand really exceeds the supply. So I think the north and the south of the country have made more advancements in terms of quality health supply, and east and west have not really kept pace. So I think, there is just, I don't really consider medical tourism to be a huge factor, but just simple local residential demand for quality healthcare is what is driving it.
Point taken. So Dombivli is one of the which I think will get commercialized in the second half of FY26. But what about the other ramp-ups? Is there other greenfield projects that you're looking at commercializing as well? Because the street clearly likes the fact that you're able to break even your hospitals at a faster pace. What's the break-even expectation for Dombivli and the rest?
So far, all hospitals that we have done have broken even in about 2 years or less. Thane was positive in the first year, actually. Pune and Indore around 2-year mark. Dombivli also, we think, should follow a similar trajectory. The local demand there, again, is quite high. It is dense population, a lot of residential communities there who don't have access to good healthcare. And it is kind of in our backyard. Thane naturally drains into connects to Dombivli well. So the patients, the doctors, the communities have a long association with us. So it was a natural choice.
Dr. Thakkar, also talk to us about how are the yields in the western belt? Are the yields better? Because people can pay up for much more complex procedures, appreciate
what better, sorry?
Yields. How are the yields compared in the western belt compared to the south? Is the higher prosperity in this region also leads to better yields because people are open to taking much more complex procedure, much better quality and complex procedures as well?
So to be fair, I think the cost structures are different in the regions as well. So it is would not be fair on my part to say that because the ARPOBs and the revenues in West are higher, therefore, consequently, the margins are higher now. If you see some of the South-focused hospitals also, they are reporting respectable and good margins. So I think along with the ARPOBs and the revenues, the cost structure seems to adjust itself. Again, with the increasing penetration of insurance, the reliance on out-of-pocket payment for serious healthcare is going down year after year. Therefore, there is not too much of hesitancy or reluctance in the patients, choosing to treat themselves. So on the financial side, I think that trend will impact not just West, but throughout the country.
Sure, no point taken, but I just wanted to get a few numbers from you as well. I understand that your average occupancy is closer to 60%. When do you see that headed to, let's say, 65-70%? And similarly, with respect to the EBITDA margins, is 22% the sustainable number? Or do you expect it to inch to 25% in a few years?
So again, if we break it down, then Thane being the oldest unit would, have occupancies higher than 70%. Pune and Thane would again have margins higher than 22%. Indore, which is relatively new, is having a little bit of dilutive effect on the consolidated numbers, both financial and operational. So on the group level, in the next couple of years, we definitely expect with contribution from Indore picking up, that both the contribution on the financial level and the occupancy should go up.
Okay, fair enough. On that note, we'll let you go, Ankit. Appreciate you making time speaking with us. But just before I let you go, Ankit, a quick question, because we here are just intrigued and curious about all the reports that we're hearing on COVID. Your initial sense, if anything, is this a serious variant at all, JN1? We should pay attention, or is it going to be another Omicron that obviously the numbers might be large, but it's not going to be as serious?
So far, we are not seeing too many of them. We have seen a few, and of what we have seen, they seem to be mild in the Omicron variety of symptoms. So fingers crossed. We hope it is not severe again, and we continue life as we know it.
Okay, Ankit, on that note, we'll let you go. Thanks so much for providing that clarity. But